Ebola has been around since 1976, but has been making the headlines since its recent outbreak in West Africa, where nearly 5,000 cases have been confirmed, and the number is climbing.
What happens is that the folks who live in Sierra Leone and Nigeria and Liberia who eat bushmeat end up getting the Ebola virus. So bushmeat is actually bats and animals which are bitten by bats. And when undercooked, that's how the folks who live in West Africa were becoming victims of the Ebola virus and then developing the Ebola viral disease.
Not only can you get Ebola through bushmeat, but also through body fluids. This includes saliva, sweat, bowel movements, blood, and vomit. Once a patient is infected with the Ebola virus, the incubation period takes 2 to 21 days for the patient to become symptomatic and contagious.
If 21 days ago you came across somebody you think may have had active Ebola viral disease, and it was more than 21 days ago and you're not symptomatic, the chances that you're going to develop Ebola viral disease, hemorrhagic fever, are so negligible that it would be less than 1/1,000,000th of a percentile.
Symptoms can include flu-like symptoms, fever, night sweats, chills, body aches, and progresses to nausea, vomiting, and diarrhea. If a person begins showing these symptoms and has been in contact with a person infected with the Ebola virus, they should be isolated immediately and health professionals should be notified. To prevent the spread of this disease, wash your hands thoroughly with antibacterial soap or an alcohol-based hand sanitizer. Avoid contact with the infected and any items that may have come in contact with them. To help the humanitarian effort in West Africa, soldiers from the 463rd Medical Detachment Veterinarian Service Support will be deploying to Liberia to make sure all food and water products consumed by soldiers are safe to eat.
For the day-to-day mission, this is the same as we would do anywhere. Obviously, the environment we're in does shape some of the differences. We are worried about the disease threat, and that's not just Ebola, that is malaria and yellow fever. Africa as a continent has a vast biology that allows for more risks. Our soldiers are trained and ready to deal with all of that.
The soldiers heading to West Africa will not be working directly with Ebola patients or healthcare providers, but will be given the latest safety equipment and following up-to-the-minute protocols as determined standard by the U.S. Army Public Health Command and CDC. For more information on the Ebola virus, visit the CDC homepage at cdc.gov. Katie Cooke for Benning TV.